Goni skill, elbow extension. Position the patient supine with the shoulders 0 degrees of flexion, extension, and abduction so that the arm is in close to the body. Place a pad under the distal end of the humerus to allow full elbow extension. Position the forearm in full supination with the palm of the hand facing the ceiling. Remember to test the unaffected limb first. In patient-appropriate language, ask the patient to extend the elbow. Assess for extension of the shoulder. The pad under the distal humerus and the plinth help prevent shoulder extension. Extend the elbow by moving the hand toward the plinth and applying a slight counterforce to the distal humerus. Maintain the forearm in supination during the motion. Stabilize the humerus to prevent shoulder extension. The end of extension range of motion occurs when the resistance is felt and additional motion causes extension of the shoulder. Assess the infield of the joint. This is hard because of contact between the olecranon process of the ulna and the olecranon fossa of the humerus. Occasionally the infield may be firm because of tension in the anterior joint capsule, the collateral ligaments, and the brachialis muscle. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you'll be using. Align the axis of the goniometer over the lateral epicondyle of the humerus. Align the stationary arm with the lateral midline of the humerus, using the center of the acromion process for reference. Align the movable arm with the lateral midline of the radius, using the radial styloid process for reference. Ask the patient to perform extension of the elbow as done previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the shoulder. Read the degrees of motion on the goniometer and then ask the patient to return the arm to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion, according to the American Association of Orthopedic Surgeons, is 0 degrees. Recall that not being able to extend the elbow fully will result in a negative degree documentation.